This is NNI Bites, Big Learnings, a podcast where fellow healthcare professionals share conversations on nutrition science's latest. We are joined by Professor Gary Wong and Dr. Ralf Heine as they share their knowledge and insights on dietary strategies for early immune modulation in primary food allergy prevention.
Hello, everyone. Welcome to this special podcast, NNI Bites, Big Learnings. The topic for discussion today is food allergy, nutrition, and prevention strategy. Now, of course, this is a very important topic, and it's great to have Dr. Ralf Heine joining us today. Dr. Ralf Heine is a specialist in gastroenterology and allergy with a special interest in food allergy. Welcome, Ralf.
Thank you, Gary. It's a pleasure to be here and to be part of the podcast. Thank you.
Now, for this topic, I'm sure many of us in our clinic, we see a lot of parents coming to ask us about questions related to food allergy. Especially this problem is getting more and more prevalent across the world. The first question I would like to discuss with you is looking at what type of infants would be at highest risk for the development of food allergy.
I think this is a question that is getting more complex to answer as we are seeing an increase in food allergy pretty much worldwide. And initially, this seemed to be limited to infants, for example, with severe eczema. But we're now seeing increasingly infants also who don't apparently have any risk factors that we can easily identify, who still develop food allergy at some stage during childhood. So this is a real conundrum that we're trying to sort out and to come up with practical advice that actually modifies the risk in infants to develop food allergy.
And of course, a lot of parents will ask the very important question because one way or another, they know a friend, a child develop food allergies very early on. And they would like to ask about feeding practice, in particular in relation to complementary feeding. What sort of advice would you give them, in order to help them to minimize the risk for the development of food allergy?
Yeah, this is the typical question that as clinicians we get asked a lot, and particularly young parents who get conflicting advice from the internet, from friends, from grandparents, and everyone has their bit to say. But the evidence is fortunately getting clearer. And in the past decade or so, we've seen a complete turnaround in recommendations. If you look back maybe 10, 15 years, the recommendation was to avoid foods that may cause allergies like peanut or egg and to delay the introduction and really to come from an approach of fear of these foods. And I think in recent years, and there have been several landmark studies, this advice has completely been turned on its head. And now the advice is to introduce foods that may cause food allergies early as part of early weaning foods from 4 to 6 months. So this is something that parents are struggling with because they hear these conflicting stories, and we have to really do a better job to convince parents to introduce these allergenic foods early as part of the complementary diet.
Yeah, it's very right on. It's very interesting. When we look at the results from recent trial, for example, the LEAP study, the Learning Early About Peanuts clinical trial, which clearly demonstrate in high-risk infants that if we start peanut introduction early on, like 4 to 6 months, that will result in a dramatic reduction in the risk of actual peanut allergy at 5 to 6 years of age. And yet, now because of all these findings, Australia is one of the first countries that changed the guideline back in 2016. But it's very interesting. In the clinical trial, it seems to be very effective. And yet, in a community level in Australia, the recommendation doesn't seem to translate into a dramatic reduction in peanut allergy across the community. And I wonder what could be the reason explaining this phenomenon?
Yeah, that's a very good question, Gary. There has been a lot of speculation. So in Australia, we have one of the highest prevalences of food allergy in the world. And the community awareness for food allergy is very high. So people are very tuned in to stories about food allergies that happen left, right, and center. And there's everyone at another child at school or at creche or at kindergarten with food allergies. So I think parents are very aware and very sensitized to the topic. And the previous guidelines have been updated in 2016 based on the findings from the LEAP study, which showed a dramatic, like 82% reduction in peanut allergy in a high-risk population. And that's something that's very important. All these studies are done in high-risk populations where there is already evidence of sensitization, for example, to another food, or severe eczema, or like infants and children selected on the strength of risk factors. So this is an enriched population which helps you to find an effect in a study. But it's problematic to roll this out at the population level, because at the population level, not everyone is high risk. And I think that is already a difference. And then from the LEAP study, the recommendation was really not that clear about what dose at the population level things should be introduced. The LEAP study had quite a high dose of peanut introduced from an early age, and the recommendation was in Australia to introduce any peanut as part of the weaning diet before 12 months of age. And that was already a big turnaround from the previous recommendation. And with hindsight, and there have been follow-up studies done in Melbourne, the effect was not that convincing, or actually disappointing, because there was only maybe a slight reduction in the incidence of peanut allergy. And one risk group that has crystallized out were families of East Asian background with a recent migration background in Australia, who seem to have the highest risk of food allergy in Australia. So this is something that is not completely understood. But I think the failure really of the revised guidelines to make a big reduction in food allergy in Australia really raises the question: are we? What is the optimum timing? Is maybe before 12 months too late? Should it be earlier? Should it be before 6 months or before 8 months? So what is the best timing? I think that's a question that's still open. And what is the best dose? So do we need to go to 2 grams of peanut per week, or is a lower dose maybe effective? And there are actually several studies coming out of Japan showing that low dose interventions with egg, for example, could also be useful in reducing the incidence of food allergy and egg allergy in particular. So these are all bits of information. So it may have been a case of too little, too late, but I think the exact reasons for the lack of reduction in food allergy in Australia are not completely understood yet. The guidelines are not always very clear, and I think that's one of the critical pieces in changing food allergy levels at the population level, that the guidelines actually have to give very clear and practical instructions to parents. And I think that is something that is also a learning maybe from the past.
It's great to have all these lessons that we can learn from the Australian experience. It's just telling the parents to feed the infants peanuts. We just need to support them at the right time and at the right dose. And otherwise, it may be too little, too late. Very good. So far, we've been discussing about the strategies for the prevention of food allergy. But let's talk about the other type of allergies that children may be predisposed to. Now, in case breastfeeding is not possible, is there a role for the type of infant formula that may contribute or help to prevent the development of, for example, eczema or other type of atopic disorders?
This is a very good question, and this is a scenario that is not uncommon. When breastfeeding is no longer possible, so maybe start on breast milk, and the parents decide to transition onto a formula at some stage and want to use a formula that does not predispose to food allergy or that has protective effect. The area is a little bit controversial because there is no black and white answer. But it appears that a partially hydrolyzed cow's milk-based formula have a preventive effect, at least for eczema. And this comes out of a big German study, and also a meta-analysis that is done with when it is limited to 100% whey partially hydrolyzed formula. But when you take all partially hydrolyzed formulas that are marketed around the world, this effect is no longer evident. And this probably speaks to the heterogeneity within all these formulas, because there are different degrees of hydrolyzation and preparation. So I think if you take all these partially hydrolyzed formulas together, the effect is probably no longer evident. But for the 100% whey partially hydrolyzed formulas, this has been shown even in a meta-analysis. So does this also apply to food allergy? At this stage, unfortunately, we don't have any evidence in that direction. So that although eczema is a precursor often to IgE-mediated food allergy, the prevention studies that we have for partially hydrolyzed formulas showed a reduction in egg sensitization and eczema, but unfortunately not a total prevention of food allergy of any sort.
So certainly over the past decade or so, we've learned a lot more about the possible role of nutrition, complementary feeding, and type of formula for helping to reduce the risk of subsequent development of food allergy and related disorders. And thank you so much for explaining the role of early introduction. And also there are things that we need to learn from how to translate the findings from our clinical trial to the community setting. And I think we've learned quite a bit from Australia in this respect. And of course, in case breastfeeding is not possible and there is a potential role of certain specific infant formula to support or reduce the risk. But as you mentioned clearly, not all the preparation, even though they have a label saying hydrolyzed, but there is different process of hydrolyzation. And we need a lot more of learning and research in that field in order to tease out the fine details and what would be the best strategies. And thank you again, Ralf. Thank you for joining us.
Thanks so much. It's been a pleasure.
And that concludes today's episode. Thank you for joining us with Professor Gary Wong and Dr. Ralf Heine as we talked about dietary strategies for early immune modulation in primary food allergy prevention. We hope you enjoyed and learned from this discussion experts and that this will be useful for your practice.